So there's been a lot of work in philosophy and in the philosophy of medicine and in bioethics on kind of what counts as health and what counts as disease. And so these kind of conceptual questions are ones that philosophers are quite interested in. So a kind of classic debate is like, do you define disease totally objectively as some kind of statistical aberration from some norm, or is it instead socially constructed? And so disease just is what, a given society says it is. Um, and so one thing we've tried to do is say that, well, a lot of the philosophy work that's looked at, like, what do we mean by health? What do we mean by disease? Tends to be super individualistic, right? So it thinks about health and disease as these like states of an individual, like an individual, like at the boundaries of their skin, basically, like that's where health and disease is. And so, as relates to the obesity stuff I mentioned earlier, the idea is that, like, well, that kind of individualistic way of looking at health and disease, like, totally can't capture the really rich interactions that happen with our gut microbes, right? Or that happen with like our romantic partners or our friends. It's just like that individual picture just doesn't fit. And so when we say like the usual way that people talk about health and disease is overly individualistic, kind of conceptually, like we've always found that, something like a One Health framework is a nice antidote to that tendency to think too individualistically. It's a nice way to recognize, they have a nice story to tell about how health and disease states involved with eating, for example, are intimately tied up with, the microbes in our gut.